that these same data could have been interpreted as indicating that HIV is a mild virus and difficult to transmit. Neither did McCormick and Fisher-Hawk. The sort of presumptive diagnosis employed by Descartes is known as a verbal autopsy. It is widely accepted in Africa, where no country has a vital registration system that captures a sufficient number of deaths to provide meaningful death rates. While medically certified information is available for less than 30% of the estimated 51 million deaths that occur each year worldwide, the Global Burden of Disease Study (GBD) found that sub-Saharan Africa had the greatest uncertainty for the causes of mortality and morbidity, since its vital registration figures were the lowest of any region in the world, a microscopic 1.1%. These findings prompted The Lancet to acknowledge editorially that current strategies to improve the world's health may need to be reassessed, and to ponder how much more money is spent on research into HIV infection, the 30th cause of death, than into the causes of suicide, number 12, or the prevention of road traffic accidents, number 9. And why should this be? Racism and African sexuality. Whereas AIDS in the industrialized countries almost exclusively confines itself to a tiny percentage of homosexuals, drug injectors, and transfusion patients, AIDS afflicts the same general African population that faces such ancient scourges as malaria, schistosomiasis, and sleeping sickness, trypanosomiasis. This is known as the heterosexual paradox of AIDS. Champions of the HIV model attempt to explain it in two contradictory ways. Some simply declare that the paradox is temporary. They speculate that HIV arrived first in Africa, and, in time, AIDS will be just as rampant in the West. However, they've been saying this now for over 10 years. Others recognize the permanence of the paradox. They account for it by declaring that Africans are just different from Westerners. They are substantially more promiscuous and more likely to have genital ulcers. How else to explain the widespread distribution of a virus that requires, for non-ulcerated genitals, 1,000 heterosexual acts? At the 10th International AIDS Conference in Yokohama, August 1994, Dr. Yuichi Shirakawa claimed that AIDS would be brought under control only if Africans restrained their sexual cravings. Professor Nathan Klumek of the Universiteit Libre in Brussels was skeptical that Africans will ever do so. In an interview with Le Monde, Klumek claimed that sex, love, and disease do not mean the same thing to Africans as they do to West Europeans, because the notion of guilt doesn't exist in the same way as it does in the Judeo-Christian culture of the West. Such racist myths about the sexual excesses of Africans are old indeed. Early European travelers returned from the continent with tales of black men performing carnal feats with unbridled athleticism with black women who were themselves sexually insatiable. These affronts to Victorian sensibilities were cited, alongside tribal conflicts and other uncivilized behavior, as justification for colonial social control. AIDS researchers added new twists to an old repertoire. Stories of Zairians who rubbed monkeys' blood into cuts as an aphrodisiac, of ulcerated genitals, and of philandering East African truck drivers who get AIDS from prostitutes, and then go home to infect their wives. A facetious letter in The Lancet even cited a passage from Lily Palmer's memoirs as evidence for how a large male chimpanzee's anatomically unmistakable signs of its passion for Johnny Weissmuller on the Tarzan set in 1946 may provide an explanation for the interspecies jump of HIV infection. No one has ever shown that people in Rwanda, Uganda, Zaire, and Kenya, the so-called AIDS belt, are more active sexually than people in Nigeria, which has reported only 3,002 cumulative AIDS cases out of a population of 100 million, or Cameroon, which reported only 8,141 cases in 10 million. No continent-wide sex surveys have ever been carried out in Africa. Nevertheless, conventional researchers perpetuate racist stereotypes about insatiable sexual appetites and carnal exotica. They assume that AIDS cases in Africa are driven by a sexual promiscuity similar to what produced, in combination with recreational drugs, sexual stimulants, venereal disease, and overuse of antibiotics, the early epidemic of immunological dysfunction among a small subculture of gay men in the West. The research from Africa suggests nothing of the sort. In 1991, researchers from Médecins Sans Frontières and the Harvard School of Public Health did a survey of sexual behavior in the Moyo district of northwest Uganda. Their findings revealed behavior that was generally not very different from that of the West. On average, women had their first sex at age 17, men at 19. 18% of women and 50% of men reported premarital sex. 1.6% of the women and 4.1% of the men had casual sex in the month preceding the study, while 2% of women and 15% of men did so in the preceding year. The media misrepresentations that link sexuality to AIDS have spawned inordinate anxieties and moral panics in regions of Africa already afflicted with extreme poverty, ravaged by war, and deprived of primary health care delivery systems. The disaster voyeurism of tabloid journalism enables them to use AIDS to sell more newspapers than any other disease in history. It is a sensational disease with its elements of sex, blood, and death that has proved irresistible to editors across the world. Public health seems to require salesmanship, not skepticism. The media's appetite for scary scenarios, and its disdain for alternative perspectives enables it to treat Africa in apocalyptic terms. This marketing of anxiety helps to promote behavior modification programs to save Africa. Oblivious to the morbidity and mortality data from the global burden of disease study, journalists reflexively maintain that AIDS is by far the most serious threat to life in Africa. The serious consequences of claiming that millions of Africans are threatened by infectious AIDS makes it politically acceptable to use the continent as a laboratory for vaccine trials and the distribution of toxic drugs of disputed effectiveness like Dianazd. On the other hand, campaigns that advocate monogamy or abstinence and ubiquitous media claims that safe sex is the only way to avoid AIDS inadvertently scare Africans from visiting a public health clinic for fear of receiving a fatal AIDS diagnosis. Even Africans with treatable medical conditions, such as tuberculosis, who perceive themselves as having HIV infection fail to seek medical attention, because they think that they have an untreatable disease. Some Western scientists, including Dr. Luc Montagnier, the French virologist who discovered HIV, claim that the practice of female circumcision facilitates the spread of AIDS. Yet Djibouti, Somalia, Egypt, and Sudan, where female genital mutilation is the most widespread, are among the countries with the lowest incidence of AIDS. Does the AIDS epidemic in Africa portend the future of the developed world? The scientific establishment certainly thinks so. Biomedical funds that had been earmarked to fight African malaria, tuberculosis, and leprosy are now diverted into sex counseling and condom distribution, while social scientists have shifted their attention to behavior modification programs and AIDS awareness surveys. Good intentions, bad science. HIV tests and disease. The reappraisal of AIDS in Africa must recognize that HIV tests are notoriously unreliable among African populations, where antibodies against endemic conventional viruses and microbes cross-react to produce ludicrously high false positive results. For instance, a 1994 study on Central Africa reported that the microbes responsible for tuberculosis and leprosy were so prevalent that over 70% of the HIV-positive test results there are false. The study also showed that HIV antibody tests register positive in HIV-free people whose immune systems are compromised for a wide variety of reasons, including chronic parasitic infections and anemia brought on by malaria. The very low frequency of